Hi everyone, thanks for joining us. My name is Dr. Suzanne Chomitz. This is the second part of our segment on anxiety management. Another anxiety management strategy is teaching your child to engage in realistic thinking. When we're anxious, we see the world as a scary and dangerous place that's full of threats. For example, if we're home alone and we hear a strange sound, we might immediately think that someone is trying to break in. In some ways, this can be adaptive in that preparing for the worst case scenario can help us prepare to deal with actual danger. But this way of thinking can be maladaptive when there actually is no danger present, like when that strange sound is actually just the old house creaking in the cold. One way to help ease anxiety is to learn to engage in realistic thinking. This isn't the same thing as positive thinking, but rather it's a way of replacing anxious thoughts with more realistic ones. This teaches a child to view situations from a clear and fair perspective as opposed to an overly negative one. This can be difficult and it's best suited for older kids and teens. Help your child identify anxious thoughts by asking questions. So for example, what's making you scared? Or what are you worried will happen? What kind of bad things do you think might happen when you're at school? Some examples might include, I'm going to fail the test. I'm going to get COVID-19 and die. Or nobody likes me. Help your child challenge these anxious thoughts. Remind them that just because we think about something, it doesn't mean that it's going to happen or that it's actually true. Maybe they're thinking about the worst case scenario or exaggerating the likelihood of something bad happening. Ask questions to help challenge the anxious thoughts. So what's the evidence for this thought? If this happens, what can I do to cope with it? Coping statements can also be developed. So for example, if I get anxious at school, I'm going to try my deep breathing and that's going to help me. I am brave and I know how to handle this. You can also try making a toolkit, which is a physical container having items to help your child calm down and relax. It will be different for every child depending on their age and interests. Some ideas include activity books, word searches, stress ball, coloring books, a blank notebook, fuzzy socks, tea, candles. Healthy everyday habits can also make a big difference in a child's mood. Remember to focus on developing and maintaining healthy habits in these areas. Diet. Make sure your child is eating healthy, nutritious food. Exercise. Try engaging in 30 to 60 minutes of physical activity a day. Sleep. Try to stick to a consistent schedule while practicing good sleep hygiene. If you are worried about your child's anxiety, or if you tried various strategies and things aren't improving, or if they're getting worse, you may wish to seek professional assistance. A primary healthcare provider or pediatrician can help rule out any medical causes for anxiety and can discuss potential medication options if that's something you're interested in. A psychotherapist, social worker, or psychologist can also help children learn and practice different coping strategies for mood and anxiety in a safe and supportive environment. Ultimately, it's important to know that anxiety can be successfully managed. Remember, it's typically easier to treat anxiety when the symptoms first begin rather than after they have escalated over time. Up next, we'll be talking about coping strategies for students that can be used once they have returned to school. For more information about our mental health services, find us on Facebook or visit our website, www.drsullivan.ca. Remember to like and subscribe. Thanks for watching. Bye for now.